Okay, so get them eating. Any cats with kidney disease, it's our number one priority is to get them eating and keep them eating. Any elderly cat, it's our priority. The poor appetite reflects a combination usually of nausea, the azotemia making them feel headachy and making them just feel toxic and not very much like eating. Dehydration definitely causes them to feel off their food. And then pain, again, dehydration is painful, azotemia is painful, but pain of arthritis as well. Unfortunately, that that food intake, of course, causes weight loss, but also dehydration and azotemia and hypokalemia and weakness, and contributes to the whole problem. So down the spiral we go. And the loss of lean body mass likely will contribute to progression of kidney disease if we extrapolate from people where it's known to be an issue. So again, maintaining lean body mass is really important. So what do we do? Fluid balance is absolutely key and ties right back into our priority, you know, our immediate priorities for the cat, and the fact that dehydration is also on our list. So if we can manage the clinical and subclinical dehydration, we will go a long way to making the cat feel better. If we can get the cat on good analgesia, that will help the cat to eat better. We can manage nausea. We've already talked about meropitant and ondansetron. Meropitant is obviously licensed for use in cats by injection and for dogs by tablet, so that's a good first place to start. But ondansetron, if the meropitant is not doing the job, ondansetron is a very good treatment too. If we can manage constipation, constipation will stop them wanting to eat because they just feel too full and bunged up and not very nice. We touched right at the beginning of the day on the controversy of do we or do we not use antacids, and we touched on the fact that actually in cats with kidney disease, post-mortem studies of stomach histopathology does not support that uremic gastritis is an issue in cats the way we perhaps previously thought it was and the way that it is in people. Nevertheless, there are certainly some cats who eat better when they are on an antacid than not. So given that there might be quite a lot of things we're throwing at this owner at the moment, that might not be our top priority, but we might mention it as something that we can use. Some owners who are on it themselves will be very pleased to take it on and will want to do that. So, you know. And then, again, we talked about appetite stimulants, we talked about mirtazapine. It's both an anti-nausea and an appetite stimulant, so it fits well into the scheme of what we want to do. It is cleared by the kidneys, so for cats with kidney disease, it's suggested to give it every other day, but for all other cats, every day. When we first started using mirtazapine, it was suggested that it could be given twice a week. We now recognise that for most cats, it's best given at a low dose every day, so the 2 milligram tablet every day, but every other day if they have kidney disease. And before we had mirtazapine, we used cyproheptadine, which is an antihistamine. It's still there, it's still available, it still works very well for some cats. So if the mirtazapine is not doing it, or the cat's getting a bit wired on it, then cyproheptadine is an option. Periactin is the trade name, good old-fashioned, cheap and cheerful. Again, not licensed, but there. So a lot that we can do, but right at the top, fluid balance, and that really is crucial. So how are we going to maintain good hydration? Owners will say, but she drinks lots, you know, and they do drink lots, but they pee even more. And cats don't have a strong sense of thirst. So for a cat, they expect, in a healthy cat, in a wild environment, is designed to get all the fluid it needs from the food it eats, and not to expect to find very much free water around its environment. So they don't have a strong sense of thirst. They expect that if they've eaten well, they will have taken on enough fluid for, if they're because their brain still thinks they're eating prey that they've caught and dragged down and killed and eaten, and their brain assumes they've got healthy kidneys and haven't got excess losses. So if the cat brain says, I'm not hungry, then the cat brain also says, I've got plenty of fluid, I don't need to have a drink. So however much water there is around the place, they won't take it if they don't know that they need it. So it is very, very common for cats to be subclinically dehydrated, especially cats with kidney disease. If we get to the point of being able to identify it on our exam, how dehydrated do they need to be to find it clinically? About 5%. So if we can see it, it's definitely there, but if we can't see it, it can still be up to 4–4.5%, which is significant. And for most cats, they run at a level of dehydration all the time, and as they get older and their kidneys less good, it gets, it gets worse. And being dehydrated will contribute to their clinical signs, their nausea, their discomfort, and so on. So it's very, very basic, simple stuff. But if we can identify and correct it, and if they are, if a cat like Goblin comes into you clinically dehydrated, you can see it in their eyes, in their skin, in their, in their third eyelids, whatever, and the owner will let you put them on IV fluids, that's a perfectly reasonable thing to do. But many owners, if you start that road of he needs to be in the hospital on a drip, will start to think, hang on, where are we going with this? That's not tenable, enough's enough. So measures to manage the dehydration at home are usually much more powerful. So oral fluids, wet foods, adding water to the food, tasty fluids, water bowls, all that stuff. All the stuff you would do for a cat with cystitis, we need to be doing for cats with kidney disease and just older cats in general to get more water into them than they think they need. And subcutaneous fluids can be an absolute lifesaver for cats with chronic kidney disease. We very often give it in the clinic just when we're seeing the cat. So we say, right, we're going to give him a bolus of fluids and then send you on your way with all these other wonderful things. But have a think about doing this yourself at home. Do it in the consulting room in front of them, show them how to do it, send them off to look at YouTube, because there's a billion videos on YouTube of owners giving fluids to their cats and saying how marvellous it is. And for a lot of owners, they can take that on. And a lot of owners giving subcutaneous fluids 2 or 3 times a week is a great deal easier than asking them to give metazapine once a day or every other day or whatever. So really majoring on fluid balance. I alluded earlier to the fact that as well as YouTube, which is a very useful resource for all of us, International Cat Care have a lot of owner advice pages on all sorts of things, and they have a written page about giving subcutaneous fluids to your cat, and a video which we made some years ago now that's my sister's cat Ozzy, who's a very fine demonstration cat for many of our videos because he's such a star. So that's Ozzy getting some subcutaneous fluids, so owners can go to those sites if you want to direct them to a site that you know of. So there's a lot of resources out there, but getting subcutaneous fluids into the cat is very practical, very easy. You don't need to shave the fur. Just literally a needle under the skin, run in some fluid, usually 2 or 3 times a week, but sometimes daily, and it can make a massive difference.